Vanderbeek's death, a somber reminder of the increase we're seeing of colorectal cancer in healthy middle-aged people. Doctors recommend early screening for anyone at risk. So what are the red flags to watch out for? We're joined now by Dr. Tracy Proverbs-Singh, gastrointestinal medical oncologist at the Hackensack Marie and John Theurer Cancer Center. Doc, good to have you with us here this morning. A little background here on colorectal cancer and just how prevalent it is right now, and how does it start?
Thank you for having me, and thank you for bringing attention to such an important topic. In terms of colorectal cancer, it starts as a polyp in the colon, and it spreads and transforms into a cancer. Early detection is key. It's probably the second most common cause of cancer in patients, and it's uniform in men and women.
We talk about screenings, of course, colonoscopies, any type of early detection obviously is going to help whoever the patient may be. At what ages and with what regularity should people begin getting screened for both men and women?
Yeah, the guidelines have changed, and the recommendation now starts at age 45 for screening colonoscopy, not 50 as it used to be. However, if you have a family history or if there are symptoms, that screening should start sooner.
And as far as like the regularity, as far as how often you would need a colonoscopy, does that vary for men and women? Is it an every 2 year? I mean, I've heard, I guess, every 2 years, every 5 years. Where does it stand now? What do you think is best?
Yeah, they're varying results. So a standard patient who has no symptoms, 5 to 10 years, is appropriate for screening for both men and women starting at age 45. However, if the gastroenterologist finds polyps, that changes the guidelines, that changes the time frame. It depends on if it is a precancerous polyp or just a hyperplastic polyp. This is a discussion that has to be had with their gastroenterologist.
Are there some early warning signs that people should be looking out for?
Yeah, of course. So whenever you have a change in status, so change in bowel movements, unexplained weight loss, abdominal pain that's persistent, blood is never, should never be ignored, especially when mixed with the stool. We think of constipation and pencil-like stools are reasons to get evaluated. However, I always caution people that most patients with early stage colon cancer do not have any symptoms at all. And this is why screening is critically important.
Is there a group that's most at risk for this type of cancer?
Yeah, colon cancer, unfortunately, is a universal problem. It used to be in the aging and now younger folks. But there are certain populations that have increased risk. Those with unhealthy weights, obese. Unfortunately, Black African-American men are more at risk, have a slightly higher risk of developing a colon cancer. Smokers and people who drink.
You hate to use the death of someone, obviously, who a lot of millions of people know about through their popularity, whether it's TVs and the movies, to bring attention to a cancer like this. Why are we seeing an uptick in people younger than 50 with colorectal cancer?
Yeah, I think it's critically important, actually, for celebrities, especially somebody who was so vocal about their struggle with colon cancer. When we look at patients that are under 50, there's no specific criteria that increases the risk. We know that it's a combination of lifestyle, our diet, lack of exercise, certain habits like smoking and excessive alcohol use. And then there's also environmental factors that we're still parsing out, and that interplay with our immune system and our gut health. We think of the microbiome or the immune system within our gut that helps protect us. All of that related to the uptick. And we are seeing it in the US specifically over the past 2 decades. The rates have steadily risen over the past couple of decades.
Dr. Proverbs-Singh from Hackensack Meridian, thank you. We appreciate the time.
Thank you.